Hi, I'm Sean. Do you have an uncontrollable urge to see blood? Do you burn whenever sunlight touches you? Well, you might be a vampire and in desperate need to learn how to draw blood. Good thing I'm here to show you what's required, the things you need, and the basic procedure of drawing blood and what to do with your victims after. Today I'll be showing the things you need. I'll demonstrate the basic procedure of drawing blood, and I will demonstrate what to do with your victims after the blood is drawn. So first, we'll start with the things that you need. So first, you need gloves to keep your hands from getting blood on them. You need a tourniquet to help restrict the flow of blood. You need a double-edged needle to gather the blood. This is just a separate needle for smaller veins. These are called vacutainers, which suck in the blood. We'll call this one breakfast, lunch, and dinner. This is a hub that attaches to the needle to help control the movement of the needle for the person drawing blood. You need alcohol to make sure the blood you get is clean, and a gauze pad for after the blood is collected. So let's move on to our victim, and we will show you the process of drawing blood by really drawing his blood. So the first thing you'll do is apply the tourniquet. And then you always palpate for where a vein is, which a vein is always bouncy, just like a stretched out rubber band. So there's a good one right here. You can see it bulging out right there. And then we'll undo the tourniquet. Take a gauze pad, clean the area, in circular motions moving away from the vein. We will gather our needle in our hub and put them together. And there's the needle. We'll put on our gloves. Reapply the tourniquet. Grab a container. Make sure our aftercare is ready. So a gauze pad, some tape, and the pad. And then we'll go to draw the blood. So when you draw, you'll always go for right where you were, and you pull up, and then you insert the needle. Push on the container. Wait for the blood to come in. When you're on your last tube of blood that you gather, you pull the tourniquet while the needle's still in. With the tube still in and the needle still in the arm, you pull out the tube, making the least amount of movement of the needle that you can. You can turn the tube. And then you get your gauze. And everything ready, you can place it over top of the needle before you even remove the needle. And then in a quick, swift motion, you take the needle out and close the guard first. Apply firm but gentle pressure. Keep from having a hematoma or a bruise. And then you can take some tape and apply it to the area. This way, you keep a constant flow of nutritious blood. So, today I explained the things that you need to draw blood, and I gave the basic use of each. I showed you the basic procedure of drawing blood from your victim, and I explained what to do after, placing the gauze, and then you label a tube with their name, their date, the time of draw. Now that I've shown and explained how to draw blood, don't go and draw blood. It's sunlight out. You'll get burned.